So first I would like to ask for your permission to use this video for educational purpose.
Anything you need.
Thank you. Now tell me about your symptoms before the surgery.
Before the surgery, I was wearing a back brace constantly. I was trying to get more radiofrequency ablations, epidural injections. Nothing was helping in my lower back and pain in the leg.
And tell me about how long did you have that pain?
It was about 3 years. Traditional method of physical therapy never worked. Every type of injection you can think of, ointments, TENS units.
1 to 10, how bad was the pain?
The pain was up to the point where I couldn't even walk.
Okay, and we did the surgery when?
On the 23rd.
So about 10 days ago.
About 10 days ago.
And tell me about this surgery. How long after the surgery did you start walking?
It was 2 hours. They got me up. A physical therapist did. Walking, just with a little bit of a walker. Pain in the right leg was instantly gone.
Excellent. Now you stayed in the hospital how long?
One night.
Just one night. And so far, tell me about your symptoms now.
The symptoms now, everything in the right leg and lower back, gone. As Dr. Bossi told me before the surgery, I could expect a little bit of nerve irritation on the left side where they went in, and I have just a little tingling in my big toe and a little wobbliness from that. But other than that, everything with the pain meds he's prescribed, it's remarkable.
Excellent. Well, I'm really happy to hear that nerve irritation, we usually talk about there's a 15% risk of it. It's mostly in the L5-S1, and your levels are actually is L5-S1 as well. Here you see that here are the screws that going in, and the cage as well in the right position. The hole where the nerves are going out are pretty open, and here again we see the screws. The cage, what we call that spacer, we call it a cage, and then the screws in the L5, cage in the 4-5, and here are the screws in the L4. So we are happy with the positioning, and that irritation that you talked about may get worse with certain activity, as well as may turn into some stingers like electricity jolt, but that's actually a sign of the healing. Overall, how's walking actually?
Walking is better than I ever
Excellent.
could imagine. I can actually stand up straight. Like I said, just a little wobbly with the nerve
Excellent.
irritation on the left side, but walking is better. I want to go back to work right now, but I know that's not a possibility right now.
Because your job is?
Construction.
Okay,
Right
yes,
now.
exactly. Well, thank you so much for this interview.